and congratulate all the organizers who have invited us today. My special thanks to Dr. Priscilla, Dr. Anjana, and Dr. Kripakaran sir.
Thanks to DEEPAM Medcon for this opportunity, though I'm part of this college. I'm so honored to chair this important session. Tambi.
It's my pleasure to introduce Dr. Sangeetha, Professor and Head Department of Biochemistry, Villupuram Medical College. Madam had done FAIMER Fellowship and she's an executive member of Indian Association of Medical Educationists and also a member in Association of Health Professionals Education India. In her 13 years of teaching experience, Madam had published more than 25 research papers. Madam had received Best Doctor Award and State Award for Best Teacher from Indian Medical Association. Over to you, Madam.
Okay, thank you so much for a very nice introduction, madam. We have a little bit technical challenges. They are connecting with the Zoom. So let me introduce my topic, the forgotten art, reintroducing this health humanities in this medical practices. And first thing, I apologize to the audience. Here, the medical practice is related with the health humanities only in the context of classroom setting only I'm going to discuss, not in the clinical setting, because I'm the basically medical biochemist. So please bear with me. And how many of you, why you are interested in this, attending this conference? Why? Sometimes maybe Kirubagaran forced to attend. No, influenced to attend.
Sounds novel, humanism often forgotten. So we thought you're going to introduce the term again in a different platter.
No, I'm not only this topic, this conference.
This conference, basically we are academicians.
Yes.
So we wanted to deal as a facilitator, as a teacher, what are the things that we need to know to manage the next generation people and to have a change in ourselves.
Okay, so simple word, this according to the NMC norms, lifelong learner.
Lifelong learner.
Yes, ma'am. Anything else? Anybody, any other answers? Sir? Okay, CME credit points. Okay, so the lifelong learner, I would like to take in this my topic, one thing. And second aspects, how was it? The past 1.5 days, how was the event? The echoing word, organizing, superb. Leadership, superb. Am I right? Thank you. So with this, okay. So my slides are ready. I forgot to thank this organizing team, and my disclosure is nothing to disclose except a few images I got it from the Google and a ChatGPT. So can you guess what it is? I have 2 brownies for this 30-minute session. So who are answering not this question? So inside there is a lot of questions for you. So you can get it. Any guess? It is a classroom setting? Classroom? Okay, it's a classroom setting. So what kind of a teaching learning methods? It's a conference. Because few of them looking a mobile and some of us are roaming around there. So we have to accept it. This is a conference setting. Then that this next question I asked you people, why you are attending this conference? The one concept is you are all lifelong learner. And another questions I want to ask with you people, how was it? How was it? The 1.5 days. It's awesome. Awesome. It is a motivation. It's a motivation. Okay. Motivation to do something. You are a change agents. Here, all the delegates are highly influenced, highly interested in attending this conference that make me a humanistic value. Am I right? And the another echoing words, all the chairmen are sitting, a wonderful CME, wonderful CME. We can beautifully elicit this organizing skills of this team leading by this conference. That is value of in humanistic. I will explain later. And with this images, what a disposition of making this a noble profession. The two noble persons you all very well know. Related with the humanistics, madam. Why they are called it as a noble person? High level empathetic, and there are excellent leaders. Yes, agree with this. Anything else? Why they have taken as a leader? What are the main characteristics, attributes of the leader? The lead by examples, role model. Yes.
Human values, ma'am. Human values, they respected and they uphold the human values.
They scaffold this human values. Yes.
Here, ma'am, altruistic selflessness.
Yes, ma'am. Altruistics, they are selflessness and working hard. And one more point I want to add on with this, they will take a responsibility. This is my society. I have to do something for this. So that's why you are as lifelong learner. You have some moral responsibility to your learner. That's why you are sitting here. That is a humanistic. So that key point I want to tell it to you. So the entire delegates and the organizing team excellently will have an humanistic value. This is the platform of the humanists. So this is my next 30 minutes, 30 to 40 minutes. I'm going to discuss with you what is health humanities, how it is differ from this medical humanities, and why it is eroded in this current practices, and what are strategies we can implement in our curriculum. So this is the, we all very well know about the definition of the health. Health is a state of complete physical, mental well-being of this, including the social. So this is the WHO guidelines. And regarding this United Nations, they have developed 2013, the framework of sustainable development 17 goals. So in the 17 goals, 3 and 4, which is related to with your well-being for all, that all inclusive of all healthcare professionals, both our facilitator and also learners. So mentally and socially, we supposed to be well being with to engage with our student. So that is one of the concept I want to tell to you. And this another goal is equal quality of the education. Every children, it's a rights to learn. Every facilitator rights to teach. So that makes the quality of this education, and which will promote the lifelong learning. So all this social well-being, mental well-being, which is related with this health humanities, it is not only this medical field. It is interdisciplinary. The interdisciplinary means it is related with the history, literature, art, in addition to our social community, how the cultural will be there. Whether we are teaching this cultural competency to our learners, that is again, it is a query for us. So everything, this interdisciplinary field to explore the health humanities, how it will be work in this for patient, it will foster the empathy for the learners and also physicians. So it is a patient-centric, which helps to a high empathetic level and create the critical thinking of the learners. And it is beyond this, our pure scientific knowledge, more than that, culture and ethics. How the compassionate care we can give it to the patient, how we can treat with the dignity of this, our patients. So this is a small history. I didn't go into the depth. we can see here, it is a name coined by this Professor George by 1948, the health medical humanities. It's a recent concept. And the most of the US schools have adopted this health humanities as a separate department. And this again, it is catalyst and key shifted by this Professor Paul, health humanities. How the health humanities, it is differ from this medical humanities. Any idea? Medical humanities and health humanities. Health is related to more emotional. Medical humanities, it is more of scientific knowledge. Am I right, ma'am? So can you agree with me? Any other controversies in this? So medical humanities is a mode of this scientific knowledge, and this health humanities, the wholesome approach, the holistic approach of the patient care. So this is a recent concept I'm telling. Even the Hippocrates says, where there is a love of medicine, there is a love of mankind. And this is a quiz. Anyone can identify who is it? This is, for this picture, you will get a brownie. Clue. Pioneer in medicine. This era of 1814 to 9 something.
1840.
Sir,
Pioneer.
my teacher actually identified. Dr. Raghunath sir. Excellent, excellent. I Google it. Google it. Okay. So anyway, Ashwini, you can get it, brownie. So this is the father of medicine, Sir William Osler. Okay. So what is the connection in this humanism and this with the Sir William Osler? This is a little bit history. Okay, we'll go with the answer. So the first residential program and the bedside teaching highly is emphasized by this William Osler. So why it is needed, bedside teaching, why it is needed for our learners? Why not in this virtual reality? Yesterday, Thiruvannamalai sir did this beautifully gamification of this. Why we supposed to be teacher bedside teaching? Then what is the difference between these two?
Workplace learning is more authenticated and it gives a hands-on experience for the children.
Excellent and more authentic. So more in trust. More trustworthy, how it is comes when we enter into the real scenario. So this is a thing which is related with this, your humanism, whatever this we are virtual reality, augmented reality, whether it's matched with your real patients, it's a query. So this is a thing I want to share with you people. So it is introduced by this William Osler, and it is a I'm teaching with you people. This is putting a picture and asking you what is the history of it. This is a humanism, humanistic value. I'm empathizing how the history was evolved. So this is one part of an teaching learning methods we can give our students. And nobody is getting a brownie. Okay, so this is a basically scientifically we can differentiate how this medical humanism is differentiated between health humanities. Health humanities, it is a more of an academic tool which help in this art and literature, history, dancing, music, everything. We will make us a more empathy, cultivate empathy towards the patient, and it is makes the critical thinking and cultivate this empathy and analyzing the human values of seeing, feeling, and thinking. And finally, acting. So these are the related within health humanities. I think, am I clear with this? What is health humanities? It's an interdisciplinary field, and it is involved in this to academic tool to inculcate this empathy towards this patient care, with a lot of emotions. Okay. So this is one scenario. It is happening in this any patient setting. Mrs. Lakshmi, 40-year-old female, coming to this OPD with a diabetic patient. When she comes, we ask the histories of so and so. Only a specified history. Abdominal, this is a history. Then CVS, this is a history. And CNS, this is a history. Am I right, ma'am? I think that from first year to till final year, you are teaching this only in particular history. Am I right? So same thing it has happened in this our medical colleges also. So this is related with the medical history of this non-communicable disease in the general ward, and she diagnosed, and beautifully we have given the results and any other further investigations also done. So now you can tell me what's the difference between this cure and disease. I mean disease and illness and cure and care. So this is her history. Whenever any patients wants to tell it to you, any histories, ma, enna prachana sollupa. Vera edhum we won't talk anything else. Enna prachana sollu. So we are stopping with that itself. Where is this active listening has happened? Where is the communication? It is a query. Am I right? At least we have to teach our student from this first year itself. How it can be, we'll see later. And how now I ask you people, what's the difference with disease and the illness? What's the difference between cure and care? You can get a brownie. Ma'am, brownie வாங்க விட மாட்டாங்க.
ஆமாய்யா, நான் ட்ரை பண்றேன். Curing is caring about the means targeting the disease. Caring is a holistic approach. How she should not come back to the same doctor because நீங்க போட்டிருக்கீங்க in our village rice is the staple food.
Yes, ma'am.
How much ever you're going to diagnose and give the drug, she's going to again back have the rice. So how we are going to tackle that is the base for humanism.
Okay, ma'am. Exactly, you are right, ma'am. So you can get a brownie. So these are the keyword, the theme we have derived to the holistic approach. So the holistic approach, here we can see skipping the meal. So not appropriate diet pattern she didn't follow, and difficulty, how the travel, and this economic level, and the main fear of the complications of the diabetes. So all those things we will put into this patient care, where we are lacune, what we will teach our student when the even the first year itself, we will put a one clinical scenario, fasting level this much, postprandial this much. You have to diagnose as a diabetes. Whether I'm teaching like this, frankly speaking, till for first year MBBS student, I'm teaching, putting on scenario, giving this lab value. This is diabetes. You have to diagnose this one. So what to put this other angle, food habits, lifestyle of this individual, the patient, and this cultural diversity. She's morning she's skipping this food and doing the household activity. Whether I'm addressing to the my learner, I'm giving the histories like this, it is a query. So how it can be overcome this issue? I will tell in this upcoming teaching learning methods. So this is the difference between the disease and illness. When you see this with the lab diagnosis, you are diagnosed, it's a disease. The illness, the holistic approach, as Anita ma'am said, is a holistic approach of the patients. So we have to teach our health humanities through our learner. Where here we can see this, how much of the empathy, the economic status of this cultural diversity, how the ladies is working in this house. So all those is makes a sense in this health humanities that is different from this medical humanities only with the lab values. So this is again William Osler's excellent quote: "The good physician treats the disease. The great physician treats the patient as the whole of the disease." And yeah, I think any of the clinicians here, ma'am, I want to treat like this only, but I cannot do it. Why? I want to treat like this holistic, empathetic, but I'm unable to do. Why? Physician யாராவது கொடுங்கப்பா.
lack of time, resources,
Yes.
busy practice, time, yes, lack of time, resources, non-rewarding environment.
Okay. Excellent, sir. So I have pointed only the 5 causes. The first thing is technology, including us. How many of you are seeing the screen? I mean, mobile screen time for every day, every day. More than 3 hours? More than 3 hours. So where is the human connection, the remaining hours? How much? So including we are not doing with this. Whenever I'm taking a viva or interact with my student, sometimes I get a call from my dean office, my peers, my family. So I'm giving a priority to that one. How many of you switch off your mobile and go into the practical lab in your practice? It's a query. So definitely there is a lack of the empathy towards the patient and my learners. The second thing is lack of training. I want to tell you here we can see this report of the last year. There is a violences due to there is no formal training for this. The violence, it is mainly due to poor communication skill. In addition, dissatisfaction. Here we can see dissatisfaction in the medical services. Sir, so burnout strategies, a lot of patients and improper ratio between the patient and the doctor. So this is maybe one of the cause for it. And what is the solution for it? The lack of the training. How to challenges the violences. How to workplace violences I can avoid. Any of you have undergone for this conflict management training here? Any resilience training here? All the administrator, vice principal madams, whether you are giving to the student. So I feel our learners can learn from, learners can learn from this. There are so many online platforms. They want this only. This training only we have to give to our students. More than this, I feel nowadays. So for that only we are working on this co-creation of flipped approach. And the second thing is burnout and emotional strategies. So the compassionate care converted into a mechanical care because of this excessive workload. And this another thing is commercialization of this healthcare. I don't want to in this so much of controversy in it. And what's the difference between this health care and healthcare? 2 words between the single word. Any idea? Healthcare. So which one is related to this health humanities? Any idea? Two term. Single term. 1, 2. Single term. Exactly, sir. Health cared by this money, it is a commercialization. So health care is the holistic approach. So I want to share with you people. So the conversation is another thing of this health humanism is lacunae. And this other thing is the fragmentations in the healthcare. So this is simply I can call it as an padam partha kadaichol. So in the padata partha, anything you can reflect. The title is Fragmentation Healthcare. How we can interpret? It is happening in our wards, routine wards. So that picture some AHS. So above some junior doctor, here some senior doctors. Here, why I have put in this arrow? Any idea? Poor communication. Exactly, ma'am. The poor communications, the fragmentations. Whenever we in the OPD, the patients planning to admit, it is seen by the CRMI. Then DAP will admit. Then this one day maybe, I mean, the next day, morning maybe, our chief will give some inputs. So it's a fragmentation of this patient care. So that is, there is a lack of this communication. So total dissatisfaction of this, our, patients. So this is the thing I want to tell you. And the another concept is this organ-based teaching. So the organ-based teaching, organ-based diagnosis make a more narrow down of this learners. So this is one of the concept I want to tell it to you. If it is any possible to implement in our healthcare sector, the holistic approach, not it's a one doctor seeing this patient, it can be carried out by this others in our sector, in our Tamil Nadu government. It is impractical. Ma'am?
We are yesteryear people, means older generation. We had grand rounds.
Yes, ma'am.
So we'll go along with the chief, associate, assistant, PGs, CRM, everybody will be there. We take the message from the chief, spoke, and that instruction will be carried on down till the paramedical people. Now, as you said, it's totally fragmented.
Yes, ma'am. So now I think you all agree with this. And the one more point, the clinical clerkship, maybe it can be implemented. Clinical clerkships, we can teach our learners the following of this patients and all. Whether it is beautifully, it is implemented in our sector, it's again it's a worry. So this is a fragmentation of the healthcare. One of the point I want to share with you to affect this, our health humanities, and the fragmentation of this diagnosing a disease. Fragmentation of this organ. For example, I discussed with my one of the orthopedician senior doctor. Ma'am, nowadays the orthopedicians are specialists in the spine surgeon, especially in the shoulder surgeon. So only they are looking at the shoulder. They are not at the holistic approach. They are not looking into the patient. So that is one of the component, lack of this eroding our healthcare humanities. And the again thing is a lack of cultural competency. This purely undermined in our medical educations. For example, adaptability, acceptability, even including this our facilitator, difficult to accept this CBME. Acceptability and adaptability is there, and this lack of conflict resolution. I explain you. And the linguistic issue. The morning, our teacher told me this Tamil medium to English medium of the learners, and the lack of self-awareness with the exact problem of the sensi, and the lack of professional identity. So the lack of professional identity, anyone can explain why the lack, what is lack of professional identity in this affect the healthcare, health humanities?
Actually, the students of this generation, they don't understand the responsibilities of the doctor in the community. They still they think they can just enjoy the stay, and what kind of responsibility they have to take after they complete CRRI. That I feel personally that is very important as a professional. See, as a ordinary man, as a professional, you have lot of differences in your behavior, in your approach, in your responsibilities, and you have a council. You have to follow the norms. So much of just being a man, that kind of feel, I don't think still it has to come in a very big way to our medical students.
Yes, sir. Even our student, we never teach what is the role of the staff nurse, what is the role of the AHS. So any one of you here, you're teaching your student? No. So that is one point, is a lack of cultural competency. We are never teach our students. So with this second objective, I'm completing. This is the second objective, lack of cultural competency, which erode this medical health humanities, and the lack of training, and the first one, burnout strategy, burnout situations we are dealing. And this last, my objective is, what are the roles of facilitator, clinician? You are all clinicians, you are all maybe an facilitator and this mentors. So what innovation and integration, novelty, teaching learning method we can adopt, and what are the principles we can acknowledge, and what are the assessments can be. So with this, I will go with one small task. Here, you are all started to your tour with your family in a ship. So unfortunately, it is, you are lost it, and you are struggled to reach this, your native place. So you can list this, arrange your priority. Here your shelter and the getting a friend's food, plan to escape, reaching home. So which one is your first? Getting a friend. Ashwini getting a friend. Food. Escape. First escape.
Shelter.
Shelter. Okay. So why I'm putting this slide? Anyone you want to motivate this others, because you want to motivate your learners. For this, we have a beautiful hierarchical needs by this Maslow's. So the first base is our physiological need. So physiological need, air, water, shelter, everything it is in it. And second thing is safety, whether I'm safe in this place. And third thing is your peers. So whenever you enter this hall, first what you will do? You're looking your friends. Is it so? Then this esteem, this environment, it is okay for you. And this finally only self-actualizations. When the self-actualizations happen, then only your learning process will be started. Am I right? So how many of you entered the classroom? You will ask your students, all good? Please raise your hand. All good. Only few. Okay. So this is a part of the humanities. We empathize my learner. How supposed to be before my learning. So this is an thing I have adapted from my MHPE scholars, Dr. Minu, I thank for her, and my mentors, KSS sir and AK sir. And this Carl Rogers humanistic theory, mainly it is related to self-actualizations. Who am I? What I have to do? When I enter this MBBS, what I'm going to do? Why, what, when? It is all related with your adult learning principles. And this now we all, our learners are ready to accommodate with our classroom setting. Then how I am going to empathize my learner with a few theories I want to tell you. One is a behaviorism theory, giving a positive reinforcement. Sometimes maybe how to HOD. That's a negative reinforcement. So this is like a brownie. Yes. So that is a behaviorism theory. And the connectivism, whenever it is, I'm usually my question, my sessions, everything I will ask the questions. Anjana ma'am, என்ன questions கேட்க போறாங்கன்னு தெரியல. Questions கேட்டே முடிச்சிருவாங்க the session. So that's the concept is by this Anjana ma'am with me. And this is a problem giving, solving. So when you ask the questions, it will make the learners think. And the constructivism, for example, in this physiology class, they will take a cell. This afternoon class, same biochemistry, they will take a cell. But same, the biochemistry assistant professor, ma'am, they are not listening, ma'am. This is happening in your class. Say, sir. So we have to give, we have to identify what is the already prior knowledge to the learners. We have to build in on it. So that is a constructivism theory. And next is the humanism theory, self-actualization, so we have explained. And social learning theory, we have to make a more peer interaction. Facilitation we supposed to be, and the experiential learning by doing, he is only learning. So these are the theories we have to adopt in our teaching learning practices. Now our learners are ready for it. You all know the theories. So which theory you are going to be apply in your classroom setting to empathize your learner. So what is the role of this facilitator? Yeah, it is all this attitude communications are given by this NMC beautifully. The phase one, this much of the competency, this much of hour, this much of assessment. Do you think it is sufficient? Why, ma'am? You all, I know, you all tell this. Any competency, நீங்க எடுத்துனா CBMA எடுத்தா பண்ணா நல்ல சரியில்லை. Why it is not sufficient? Mom, now we are dealing with this facilitator and the learners.
That's what,
Yes,
you took off the banner of teaching from a teacher. Teaching is actually an art, ma'am.
Yes, ma'am.
So we should have a lateral thinking, and then we incorporate our own experiences and then put a class for them. But there are guidelines. Actually, it's need not be adopted as such. We can reconsider it. It's a framework or a scaffolding, based on which we can build our own experiences and then make it as a good facilitated learning.
Yes, ma'am. So, what I want to share with you, this attitude and communications every day, every minute supposed to be happen. Not only with this, your 4 hours for biochemistry, 3 hours for physiology. It is not like this. It's supposed to be happen every day as a role model of you people. Then we have to cultivate this empathy with this narrative competency. So end of this my sessions. So you're all going to take with this narrative competencies. And the third thing is reflective writing. So how many of you writing in your reflection every day or monthly once? Including me, 0. Including me, also 0. Anybody else? You can share, madam. Padi. So any one of you reflect yourself.
Yes. Am I audible?
Yes, ma'am.
I'm Dr. Kavita, Kilpock Medical College Dean.
Yes,
Actually, this reflective, we do it regularly, like even with our students who it may be undergraduate, postgraduates, or faculties. I ask them to reflect often what happened, so what next? And this is something that I am trying to cultivate when all of them.
Yes, ma'am. Ma'am, whether you have measured this outcome of this reflection?
Outcome of reflection, I have not measured on others, but myself, I have seen what it does actually.
Thank you, ma'am. So it is initiated in this our Pioneer Institute of Madras Medical College. Really, thank you, ma'am. Next. Next slide. So we have to encourage our learners to reflect writing and promote this leadership quality I have explained you already. And next thing is we have to develop this intrapersonal skills. And this we have to adopt this guide and this burnout strategy. I think well-being program is DEEPAM very well explained with us. And the last part of my sessions, the 6th thing I'm going to be explained with you. So as a role model, you adapt as someone is supposed to be your role model. Why you are adapting as a role model for someone? Any one of you? Who is a role model? Why?
We look up to a person whom we expect what all dreams we are dreaming, they are fulfilling it. So as a example, we are taking them as a role model.
Okay. So you have some assumption. The characters of the person
Is
you
displaying.
Yes, sir, displayed. So most of the people like Amma. Yes, I know most of this. I ask my student, most of the thing, either biological need PG, I mean need UG teacher or Amma. These are 2 concepts I have, I acknowledge my students.
Yes, ma'am, true. As Ravi sir said, we wanted to imbibe some qualities from the person whom we look upon. That's what is lacking. எங்களுக்கெல்லாம் shadow learning இருந்தது. That has been renamed as the same matter as student clerkship.
Yes, ma'am. So why Amma is mostly adopted as a role model? Because love and care. Am I right? Yes, selfless love and care. So how many of you want to be a role model to your learners? 100%. 100%. So for that we have to love and care of my child with the Maslow's hierarchical need. And how we can cultivate this empathy? I think beautifully this any foundation course, any CRMI orientation course, we will put this video. And BCME course, RBCW. So what is next for it? What's the next? We are watching only. So what I did, same thing, this my learners, I asked to do, reflect about this video. So they beautifully draw it. We have to stand in this other shoes. So இதுல பாத்தீங்கன்னா shoe மட்டும் கொஞ்சம் bigger இருக்கும். So that is a symbolic, this art we have to be incorporate in our learners. So this is the narrative skills. we have developed this, our medical education unit have a medical humanism wing. So we have developed some rubric. So in this rubric, nowadays we all wondering about why our students are looking these patients. Am I right? So what is going to be happen for it? What is the future consequence of it? Never they are seeing this patient. Only simply sitting in this demo hall, or one patient maybe come to this demo hall and this physician or a surgeon will interact with this patient, and one presenter will do this. One of the presenter of this learner will present the case. What about this others? It is again query. So we want to overcome this. Everyone want to do this. Everyone want to communicate with this. So what we have done, we have developed a rubric from our college. So we give this rubrics to our learners. In this rubric, we have list of this humanistic value, and we have given some 4 component. What is the positive aspects of this, positive aspect of this communication, and what is scope for improvement of this healthcare system? So these are the 4 components we have incorporated in this rubric. So all the children, all the learners, they have communicated with this patients. They have encountered this history of this patient. So the patient history, it is narrated by one of my student here. And after this communication, he elicit this, what are the integrity in the patient care? So what are the excellence happen? And this, what are the respect with this empathy, how it has happened for this patient? So everything they have listed out, and they have also provided the positive connection of this narration. Here we can see it is compassionate care given by the staff nurse. And not only it, this effective management has happened. So what is scope for the future? Emotional, psychologically, even the patient is struggling. So we have to overcome it. So there are a lot of reflections coming from this, our learners. Some of the learners have written, the bed making was not proper. So how, even the second year, we don't know about the what is bed making and all. It's the component of the staff nurse. The lab results are delay for this patient. When he entered the CRMA, he may be realized this that patient may be suffered with the lab results delay. So that empathetic thing we have want to incorporate in our in our curriculum. So we have given this. Student will allotted this one patient. So he has to ask this patient history. So from the patient's history, these are the component he has to be separated. So this thing we have done in our college. And this is a voice of a patient. This is another component we have done for our learners. This is the one patient voice. Kaushik?
அவனுடைய சிரிப்பை இந்த நாள் முழுசும் பார்த்துக்கிட்டே இருக்கலாம். என் அழகு செல்லத்துக்கு வெற்றின்னு ரொம்ப ஆசையா பேர் வச்சோம். இந்த உலகத்தையே வெல்லக்கூடியவனா வருவான்னு. அவனுடைய சிரிப்பை இந்த நாள் முழுசும் பார்த்துக்கிட்டே இருக்கலாம். அன்னைக்கும் அப்படித்தான் துரு துருன்னு ஓடி விளையாடிட்டு இருந்தான். 5 வயசு குழந்தைக்கு என்ன தெரியும் எதிர வரும் லாரியை பார்த்து ஒதுங்கணும்னு. கண்ணை மூடி திறக்கிறதுக்குள்ள என் தங்கம் ரத்த வெள்ளத்துல துடிச்சிட்டு இருந்தான். அதை பார்த்த உடனே என் மூச்சை நின்னுடும் போல இருந்துச்சு. என்னை சுத்தி பல குரல். 108க்கு போன் பண்ண, இல்ல வண்டி வர நேரமாகும், நாமே ஆஸ்பத்திரிக்கு கூப்பிட்டுட்டு போலான்னு. யார் செஞ்ச புண்ணியமோ போன் பண்ண 10 நிமிஷத்துல 108 வந்து நின்னுச்சு. அதுல வந்த நர்ஸும் டிரைவரும் வேக வேகமா என் குழந்தைக்கு கட்டு போட்டு நரம்பு ஊசி போட்டு குளுக்கோஸ் எல்லாம் ஏத்துனாங்க. போன்ல யாரோ டாக்டர் கிட்ட என் குழந்தையோட நிலைமைய சொல்ல இந்த பக்கம் 108ல வைத்தியம் நடந்துச்சு. என் வெற்றி மயக்கத்துல சுருண்டு கிடந்ததை பார்த்தப்போ என் கண்ணே இருண்டுடுச்சு. தெய்வம் போல 108 டிரைவர் அடுத்த 20 நிமிஷத்துல ஆஸ்பத்திரிக்கு கொண்டு வந்துட்டாரு. குழந்தைய வண்டியில இருந்து கீழே இறக்கும் போது, குழந்தைக்கு நல்லா ஆயிடும், கவலைப்படாதீங்க அக்கான்னு அந்த தம்பி சொன்னப்போ என் கண்ணுல தண்ணி கொட்டுடுச்சு. அவசர சிகிச்சை பிரிவுக்கு வந்ததும் நர்சம்மா என் பிள்ளைக்கு உடனடியா செய்ய வேண்டிய சிகிச்சைகளை ஆரம்பிச்சாங்க. முதல்ல சின்ன டாக்டர் 2 பேர் வந்து தலையில இருந்து பாதம் வரை என் பிள்ளைய செக் பண்ணாங்க. இங்கிலீஷ்ல என்னென்னமோ பேசினாங்க, எனக்கு ஒண்ணுமே புரியல, ரொம்ப பயமா இருந்துச்சு. ஆக்சிடென்ட் கேஸா போய் என்ட்ரி போட்டுட்டு வாங்கன்னு ஒரு குரல். என் பிள்ளை எப்படி இருக்கான், என்ன ஆகுமோன்னு தவிச்சு ஆனா ஒரு பதிலும் இல்ல. மருந்து போடுறாங்க, கையெழுத்து வாங்குறாங்க, ஸ்கேன் டெஸ்ட் எடுக்கிறாங்க, ரத்தம் டெஸ்ட் எடுக்கிறாங்க. ஆனா என் வெற்றியோட நிலைமை மோசமாயிட்டே தான் இருந்துச்சு. எலும்பு டாக்டர், நரம்பு டாக்டர், ஆபரேஷன் டாக்டர்னு எல்லாரும் வந்து பார்த்தாங்க. என்னென்னமோ பேசினாங்க. திடீர்னு வெற்றியால மூச்சு விட முடியல. உடனே செயற்கை சுவாசம் பொருத்தணும், அவசர அவசரமா கையெழுத்து வாங்கினாங்க. என் குழந்தைக்கு ஒரு சின்ன முள்ளு குத்துனா கூட நான் கலங்கி போயிடுவேன். இப்போ அவனுக்கு வாயில டியூபு, மூக்குல டியூபு, 2 கையிலயும் ஊசியில குளுக்கோஸ் ஏத்துறாங்க. பார்த்து கதறி அழுது. என் குழந்தைக்கு என்னதான் நடக்குதுன்னு யாராச்சும் சொல்லுங்களேன்னு மனசு அடிச்சுக்கிச்சு. வெற்றிக்கு வைத்தியம் பார்த்துட்டு இருந்த டாக்டர் ஒருத்தர், அவர் தான் பெரிய டாக்டராம், ஆபரேஷன் டாக்டராம். அவர் என் புலம்பலை பார்த்துட்டு நர்சம்மா கிட்ட எனக்கு தண்ணி கொடுக்க சொன்னார். என்னை ஆஸ்வாசப்படுத்தி உட்கார வச்சுட்டு, வெற்றிக்கு தலையில ரத்த கசிவாயிருக்கு, ஆபரேஷன் பண்ணணும்னு சொன்னார். 5 வயசு பிஞ்சு தலையில ஆபரேஷன் ஆன நான் கதறினேன். என்னை சமாதானப்படுத்தி குழந்தை உசுரை காப்பாத்தணும்னா இந்த ஆபரேஷன் ரொம்ப முக்கியம்னு எடுத்து சொன்னார். இது போல நான் பல ஆபரேஷன் பண்ணியிருக்கோம், நம்பிக்கையோட இருங்கன்னு அவர் சொன்னப்போ ஒரு தெய்வமே என் கண்ணு முன்னாடி வந்த மாதிரி எனக்கு தெரிஞ்சது. ஆபரேஷன் நல்லபடியா நடந்து முடிஞ்சது. என் செல்லம் கண்மூடி மிஷன்ல தான் இருந்தான். தீவிர சிகிச்சை பிரிவுல என் குழந்தைக்கு வலி தெரியக்கூடாதுன்னு பார்த்து பார்த்து ஊசி போட்ட நர்சம்மா, கொஞ்ச நேரம் ரெஸ்ட் எடுங்க அக்கான்னு கனிவா பேசின சின்ன டாக்டருங்க, குழந்தையோட நிலைமைய தினமும் அக்கறையா விளக்குன பெரிய டாக்டருங்க, இவங்களுக்கெல்லாம் நான் என்ன கைமாறு பண்ண போறேன்னு தெரியல. என் வெற்றி கொஞ்சம் கொஞ்சமா தேறி வரான். இப்போ என்னை பார்த்து சிரிக்கிறான், வாய் வழியா சாப்பிடுறான், கூடிய சீக்கிரம் நடப்பான்னு உடற்பயிற்சி கொடுக்குற டாக்டர் சொன்னாங்க. என் மொத்த நம்பிக்கையும் சிதறி போயிருந்த நேரத்துல நாங்க இருக்கோம்னு வெள்ளை விட போட்ட தேவதையா வந்த டாக்டர்களுக்கும் நர்ஸுங்களுக்கும், அங்க என்கிட்ட அன்பாவும் அக்கறையாவும் நடந்துக்கிட்ட எல்லாருக்கும் என் குடும்பமே என்றும் நன்றி கடன் பட்டிருக்கு. தெய்வங்கள் கோயில்ல இல்ல, நம்ம சுத்தி தான் இருக்காங்க.
Thank you. Actually, it's a voice given by any idea, either patient attender. உங்களுக்கு தெரியுமா?
Student.
Any idea? Any idea? It is given by the student or patient attender or faculty. Faculty. It is given by this faculty. So what are the positive aspects of this audio narrated reflection related to patient care? How it can be used as a teaching learning methods, I'm asking. Sir? Okay, sir. One, this communication skill. So this type of an emergency situation, we cannot, I mean, any video we cannot explain. Am I right? We cannot take a video also. So in the situations, we can ask our learners, what are the positive clues in it? How the patient attender was empathized by our healthcare system. Here we can see the staff nurse had own held with this. I mean, patient அவங்க ஸ்டாஃப் நர்ஸ் வந்து உனக்கு ஒன்றும் இல்லை, பிள்ளைய நாங்கள் நல்லா பார்த்துக்கிறோம்னு சொன்னாங்க. அந்த ஸ்டாஃப் நர்ஸ் அம்மா சொன்னது. பட் டாக்டர் சொன்னது எல்லாமே வாய்ஸ் பார்த்தீங்க அப்படின்னா அவங்க நிறைய லாங்குவேஜ்ல பேசினாங்க, நிறைய புது லாங்குவேஜஸ், த லிங்குவிஸ்டிக் இஷ்யூ. ஸோ திஸ் ஆர் கல்ச்சுரல் காம்பிடென்சிஸ் we can teach our student. Am I right? So immediately, how long did this 108 reach this our our Thai ward, and the remaining what has happened? The holistic approach, whether we can take a shoot a video, it is very difficult. So for this audio narration, we can give the holistic approach, how it can be of the patient, we can teach our learners. And this reflection, I think, it is supposed to be reporting and responding related to this your situation and reasoning, and it's supposed to be reconverted. And again, this is the reflection of this. What the first image or the second image? How we are looking into the second image? Sir? Happiness. Okay, one is our perception, it's a happiness. Then anything else? Self. The first one is a self-reflection. The second part, ma'am?
Selfie.
Selfie.
Selfie. That boy is taking a selfie.
Okay, sir. Then anything, any other inputs for this second picture? Ma'am?
This is a
Collective.
selfie without phone.
Emotions.
Emotions, happiness. Okay, sir. Anything else? Any other negative clues, negative aspects of only positive, the happiness, taking a selfie,
One boy is looking in a different direction.
different direction.
Sir,
Okay,
because that is being photographed. So that boy is looking at the other person.
okay, sir.
Ma'am, I've seen this on WhatsApp. It's not a,
Yeah.
Now you can reflect. So any other inputs? Selfie and happiness. How the technology, even young minds, it is inculcate. So that's one other angle I'm thinking. So reflection, what I'm mean to say. So nothing is wrong, nothing is right. Anything we want, we can share. So that is about reflection. So and the other thing is the conflict management of the humanism. It is needed and art, and the leadership is organizing skills and team building and inclusivity we need. So these are the EPS, I'm telling, if these are EPS, we have to teach our learners with a co-creation model, maybe decision making, taking responsibility, and the dimension of the interpersonal thing is professionalism, team building, and this communication skill, interpersonal skills. And the communication, I don't want to go in depth. You all very well know about this. And this interpersonal skills, anybody want to reflect on these two images, how it can be linked? Interpersonal skills.
It started from one person, but became multiple people by networking and interpersonal skill.
Yes, sir. So because of this Kripaharan network only, I'm standing here. Then anything else? Together we learn, together we grow. It's some philosophy adopted by our MEU. They are all are equal. They are all are equal. So then only this tree is becoming expanding. So one leader, Dr. Anita ma'am, it's built our MEU. It is next other automatically branches is going. Now Dr. Sangeetha is establishing MEU in Kallakurichi. So Tamilmani ma'am established an MEU in this Tanjavur. So this is a happening of our MEU. So interpersonal skills not bound with a single person. It is a networking. It is supposed to be with a team building. So the team building, team collaboration, we have to teach with our learners as to establish the roles and goal oriented. We have to get the feedback. And these are the few intrapersonal skills, good habits. So how many of you teach your student with the good habits? Day to day, cutting a hair, cutting a nails, shaving, everything we have to telling every day, and stress and time management, mentoring, social empathy, presentation, and positivism. So this is a humanism wing we have established in our medical education unit, and the speaker of our resource person, one of the Anita ma'am, and this chief guest by this, our Raghunath sir. So here, this from the fourth, the standing row, fifth, Dr. Sukanti only this voiced this, that narration. So the script is done by this, our pediatrician, Dr. Telagvati ma'am. So the entire teamwork, you can see the everybody is working for this common goal. Our MEU has to be developed. And this is a self-awareness scale for humanities. We have established from this our humanism wing. Beautifully, Dr. Lada ma'am is explained how it can be established in your any curriculum, any new concept, changing agent, how it can be happen with the questionnaires only. So we have put some validated questionnaires in the domains of humanistic values, ethics, interpersonal skills, role modeling among this BDS, MBBS and AHS students. Here we can see this humanistic value. There's a difference in this between this MBBS, BDS and AHS. And ethically, they are okay. Interpersonally, they want a training. There are lacuna in this interpersonal skills and guidance and teaching. So these are the other stress managements they want to be established in our colleges. Here, the peer interactions also, they have quoted 37% in yoga, meditations. And this humanism can be a part of a curriculum. They have agreed with us. And these are the few books and the cinemas. Cine medicine can provide our student with to escalate this, our humanities. And this music, dance, everything so make a place in the role. And how many of you have seen this tourist family? Most of. So what is your reflection on this humanistic family? I mean, sorry, tourist family with the humanistic value. Super movie. It is 2 minutes. Super movie. It is listed in this Oscar also. It is full of human connections. The entire movie is explain about this human connections. And this picture by my student, any idea what is the title of this scene picture? Healthcare? Excellent, madam. Brownie உண்டு உங்களுக்கு. So it is about this healthcare team. So first year student, how can draw a healthcare team, staff nurse and lab technicians. So we have established this interprofessional education between this MBBS and our DMLT. So the final outcome of this interprofessional education, mutual respect, and they want to curious to learn the others, especially, I mean, professionals' roles and responsibility. So this is the outcome of this interprofessional education. So they want a sports as an extracurricular activity. And coming to this assessment. So the teaching learning methods, one is I have told you, is a narrative component. It's a very important reflective component. The second point I want to tell you. And this assessment in humanity for an affective, it comes in this affective domain. We are in this infant stage. So we have to escalate this affective domain with the level of summative, asking this, what are the roles and responsibility of the physician as a 5 mark for this first MBBS biochemistry question. Doesn't make a sense in this health humanities. So we have to give with the 360-degree assessment and multi-source feedback with this and final summary with this. The concept of the health humanities, not only medical knowledge, it is with the bio, psycho, and social medicines. So we should acquire this health humanities knowledge that is supposed to be into the spirit. It is a intuition. I mean, it is a intrinsic motivation to learn. I mean, intrinsic motivation of the humanist spirit make the humanistic behavior. When this will rotate automatically, the another wheel will be wheel will be, it is going to be rotate. So it develops critical thinking, empathy, cultural competency, leadership, and also professional identity, moral and social responsibility. So with this, I will stop my session. பிறநோயும் தம்மநோய் போல் போற்றி அரண் அறிதல் சான்றவர்க்கெல்லாம் கடன். So with this, Thirukural, to stop. Any questions?
Thank you, ma'am. We would like to hear a question from the audience.
Wonderful presentation, Mom. Thanks for the elaborate explanation. We would like to hear from you. What are the challenges you faced when you first started implementing humanism or bring out the module, and how did you overcome it?
Ma'am, this competency for this humanities, it is in the embryo stage. First, we have started the screening part only. So what are the learners needed? So the interpersonal skills only they are asking us. So next, each domain we are planning to develop a competency, then prepare the module, then it is going to be validated, madam. So it is in the primitive stage only, ma'am. We are just started with the screening, ma'am. Yes, ma'am. Yes.
Hi, ma'am. It was an excellent presentation. Ma'am, I just want your thing about when you do students' activities related to humanism, how do you assess it? Like most of it, I know it's a reflective writing and those things. even reflective writing, how do you give them the feedback? Do you tell them after reflection? How do you assess them, or how do you give feedback?
Ma'am, only the reflection or you're asking?
Anything, any activity or any reflection? like
Ma'am,
how we
so far
assess?
we have conducted the model making, Rangoli. So everything they are focused on this interprofessional education model. So we have judged with the model making competitions. So that assessment we have done so far. And we have asked to develop an logo also, ma'am. Logo for the health humanities. So whether we, in our government sector, whether we can establish our institution, it's a query for us.
Yeah, I understood that implementation itself is a great success.
Yes, ma'am.
But when it comes to, research and other things, they ask for what is the assessment. Like even if we collect for reflective writing, we have to give feedback and there is a rubric and all. So how do you
Ma'am,
do that?
Empathetic scale we can use, ma'am. Before this, your intervention, what's the empathetic scale? After the empathetic scale, we can adopt, ma'am.
Okay, thank you.
Anybody?
Thank you, ma'am. It was an extensive, nice presentation. The topic itself is very important. The forgotten art, reintroducing the humanistics into professional practice. Yes, the art is forgotten only because we are seeing the students since 10 years. So the major transformation in the behavior towards teachers, behavior towards society, and all this, after seeing all this, the NMC has introduced the 8Com competencies. Yes. So all these are very, very essential for this today's medical students, and also have rightly addressed the fragmentation in healthcare, and also have given all the essential tips to fill the lacunas, like role of facilitators, how to cope up these gaps. Very nice, madam. Very nice presentation. Thank you, organizers, for giving me the opportunity.
Thank you, ma'am. You had taken so much of efforts to, get all the slides, even every component of every slide counted. That was what we were discussing. So much of efforts on your part. And as I went through the title, I thought it was integrating health humanistics into professional. And as madam pointed out, it was reintroducing, which means we are at that level. And you had aptly ended your talk with a kural on empathy. So nice. Thank you, ma'am.
Thank you, ma'am, for elevating our minds with your expertise talk, ma'am.